Okay, thank you for joining the Breast Cancer Task Force educational series. This series is focusing on navigating breast cancer in Colorado, resources for patients. Breast Cancer Task Force is part of the Colorado Cancer Coalition. Our mission is to reduce the impact of breast cancer for Coloradans through risk reduction, early detection, access to personalized cancer care, and comprehensive survivorship support, regardless of social determinants of health, geography, or personal community identity. The Breast Cancer Task Force is a statewide group of professionals, organizations, and community members working together to support breast cancer-related efforts across Colorado. The task force provides a space to share resources, collaborate on projects, and highlight current work in the field. The task force helps connect individuals and organizations involved in breast cancer prevention, care, and survivorship. With members representing a wide range of expertise and backgrounds, the group collaborates to create shared impact. Our second speaker today is talking about COE resources for the community, Carlo Caballero. Carlo holds a MA in clinical mental health counseling from the University of Colorado, Denver, and is a licensed professional counselor, certified case manager, and a professional patient navigator. He has been with the university for over 10 years, with his work including roles at a federally qualified health center and the CU Cancer Center. He has provided patient navigation and case management services to a wide range of individuals and communities. Currently, Carlo serves as the principal bilingual patient navigator in the Office of Community Outreach and Engagement, where he helps community members navigate the healthcare system and connect with resources across the cancer continuum. He also supervises other navigators and students in this role. Carlo?
Hi, thank you, Emily, for the introduction. As mentioned, my name is Carlo Cabarello. I am the Principal Patient Navigator for the Office of Community Outreach and Engagement. And I'm going to share a little bit of some resources that we have available for the community and that also kind of relate to breast cancer patients as well. Next slide, please. So I just want to start by giving a little information about our office. So we like to collaborate with the CU Cancer Center on cancer prevention, early detection, and survivor support. We also focus on education, outreach, early intervention, research, and advocacy statewide. And then we also address emerging concerns, expand care and research access, and improve screening. We're able to kind of accomplish these goals through several projects that we have available for the community, such as like our Fit Kit project, which is focused on providing free Fit Kits to community members. And also we provide radon testing for Colorado residents, and we have a smoking cessation app available. We also have other projects that I'm actually gonna talk about now. Next slide, please. So we have our COE Connected Care program. Next slide. So basically the purpose of this program is to assist women diagnosed with cancer through the Women's Wellness Connection program. To be eligible for this program, you need to have been diagnosed with breast or cervical cancer through the WWC program, and you do not qualify for the BCCP Medicaid that was previously introduced by our other presenter. Most of the patients that we do get referred don't qualify for BCCP due to primarily due to residency requirements. They're usually undocumented, so we can help them kind of obtain treatment for those that don't qualify for BCCP Medicaid. And they can also live anywhere in the state of Colorado to be able to be part of our program. Our goal for this program is to navigate patients successfully to treatment and resources and or support WWC clinical teams in this process. So basically our navigation is focused on assessing for social determinants of health and addressing any barriers that could impede their ability to obtain care, such as lodging, transportation, financial barriers, etc. We've been primarily focused on connecting patients with public hospital systems, such as UC Health and St. Joe's that offer the HTC program, which for those that are aware of what the HCC program is, it's the Hospital Discounted Care, which is a Colorado law that provides financial assistance for hospital bills to low-income, uninsured, or underinsured patients. Eligibility is generally based on a household income at or below 250% of the federal poverty guidelines. So we try to kind of connect patients to these hospital systems so they're able to obtain that financial assistance so they get it when they get into treatment, because the HCC program also allows for patients that are undocumented to be able to apply for that program. Next slide. So currently for our program engagement to date, we have been able to, with the help of actually Ivy Hunts and Chris McCracken through at CDPHE, we've been able to connect with 20 WWC clinics. And of those 20, 17 clinics have committed to participate in the program. And of those 17, they represent about 25 counties in the state of Colorado. As you can see in that map, there's actually the state of Colorado and all the WWC locations that are available. We obviously haven't connected all of them, but it's just I just want to show that map to see how wide range the WWC program kind of extends to. And kind of our goal as part of the COE is that we want to really try to reach as far and wide as possible in the state of Colorado, especially the rural areas that have limited resources available to them, because our catchment area for the CU Cancer Center is the entire state of Colorado. Next slide. So a little bit about our navigation outcome. So far, since last year, we've been able to receive 23 referrals. Out of those referrals, 17 have been breast cancer referrals and 6 have been cervical cancer. All our patients have identified as female, and for race breakdown, 50 of them report as white, 6 unreported, 1 Black or African American patient, and 1 Native Hawaiian or Pacific Islander. For ethnicity, about 21 patients identify Hispanic or Latino, and 2 identify as non-Hispanic or Latino. Out of those patients, 20 of them are monolingual Spanish speaker, and 2 English speakers, and 1 speak another language. And for insurance status, 22 of those patients have been uninsured, and 1 patient was insured, but they were underinsured, so they still needed help with financial assistance getting into treatment. We've been able to successfully connect 21 of those patients to HCC to get financial assistance. And out of those 23 patients, so far, we've been able to connect 22 of them successfully to treatment. The 1 remaining, the 23rd patient, is actually a new patient, so we're still working with them. But so far, the program has been very successful to get patients into treatment and also financial assistance. Next slide. So a little bit about our future direction for this program. We want to, as I mentioned, our catchment area is the state of Colorado. So we're trying to reach as far as wide as possible in the state. So we're hoping to, with the help of Ivy and Chris, we're hoping to establish connections with 11 additional WWC clinics this year, or hopefully by the beginning of next year. We've been able to connect with a few of them already, but we're hoping to connect with the remainder of them by the end of this year. So hopefully that'll help expand our reach as well. Another thing we're trying to do is we're trying to increase navigation services for mammogram access among women under 40. One thing we noticed while we were meeting with a lot of these clinics to provide this program is that there was a need for women under 40 that didn't have access to a WWC program due to the requirements of being over 40 that are still symptomatic and or had family history. So one thing we're trying to see if we can provide is a navigation service to try to help connect those women to mammographies and mammograms that are affordable or low cost or free, so that way they can have access to that screening as well. With that being said, we are trying to partner with organizations or foundations to help cover the cost of mammograms. So we have another program, the Fit Kit program that I mentioned earlier, that provides the free Fit Kits. And for those patients that do have a positive Fit Kit, we have been able to partner with the Colon Cancer Coalition to pay for the colonoscopy for those that are uninsured. So we're hoping to do something similar with other organizations to help pay for the mammographies, or we've even looked at foundations such as the American Breast Cancer Foundation to apply for their grants to see if that will help pay for some of these women to get their mammograms completed. So that's a little bit about the future direction of this program. So yeah, that's if we can go to the next slide so I can talk about another resource we have available. So next resource I want to discuss real quick is our cancer resource map. Next slide. So the purpose of this resource map is to assist in increasing access to services by providing a map of cancer treatment, screening options, and resources available in Colorado. This was actually a joint effort with Jen Kluss, formerly from CDPHE, and Christy Cahill, formerly from the Colorado Cancer Coalition. The data we were able to gather originated from the Health Data Compass, which is our data management system here at the university, as well as CDPHE was able to provide data as well for a lot of the FQHC locations. And, old trustworthy Google, we were able to just Google websites and like treatment locations available in the state to compile a list of resources. Next slide. So we originally launched this map back in 2021, and when we launched it here, what we originally had on the map were cancer treatment locations, genetic counseling locations, clinical trial locations, cancer screening and diagnostic centers, palliative and hospice care locations, and patient support and survivorship programs. Since then, in the past 4 years, we've been able to make significant updates to the map. We've been able to create a Spanish version for monolingual Spanish speakers. We've also added insurance information, so we know what insurance that locations accept, and we've also added bilingual service information. Basically, we want to know if a location has bilingual staff on site or they offer translation or interpretation services at their location. We've also been able to add a tab for treatment locations for uninsured that offer financial assistance. And we've also been able to update our cancer screening and diagnostic centers to include mammography locations as well as radiology locations. And lastly, we've also added additional resource tab that kind of highlights other resources that a patient might need while they're in treatment, such as like wigs or financial assistance, like for the Ray of Hope Foundation, things like that. So this is kind of a living document that we want to try to update once a year, and we audit to make sure the locations are correct, and we add any new locations that have been established. So we try to do that once a year. Right now, we are in a transition from a previous data analyst that would do the updates to a new one. So we're hoping that before the end of the year, we can make some updates to that map. Next slide. So here's just a little screenshot of the map, just to kind of give you a quick a look at how the map is displayed. As you can see, oh yes, sorry. As you can see by the tabs, we have different types of locations for different treatment options. Since unfortunately it's a screenshot, I can't click on them, but I just wanted to show you a quick screenshot of when you do click on the location, you can see the information that is provided. Some of the information includes address, their website, their phone number. If you would be able to scroll down, you can also see what treatment available options there are, as well as what insurance they accept, so on and so forth. One thing we're also looking to add to the map that I forgot to mention is a chatbot feature. So basically what we want to do is that a person can go on the map, talk to the chatbot about what resources or what screening they might be looking for based on their age or recommendations, and then they can be sent to a location that can provide that screening or treatment, whatever they're looking for. So that's something that's in the works that we're trying to kind of accomplish, hopefully in the next few months or early next year, but hopefully soon. But I did add a QR code as well, and also a link for those that want to kind of take a closer look and play around with the map as well. Next slide. So next I want to discuss is our CU sponsored support groups that we have available. Next slide. So basically, our office supports 3 community cancer support groups in the community. 2 of them are being facilitated by the Latino Task Force. They're both Spanish speaking. They have a virtual and in-person option available, and they're open to all cancer types. We also have another support group that's English speaking, that's called the Stronger Together support group, that's facilitated by the Therapist of Color Collaborative. This is a monthly virtual support group, and it's also open to all cancer types. Basically, what we're doing is we promote them through our social media outlets as well as our partners to get the word across, so people join the support group. And we also provide funding to pay for their facilitators for each of these support groups. That way, they can kind of stay up and running, because we know that can kind of be a burden sometimes. But can we go to the next slide? So I put here both the flyers for each of the support groups, just so you can have a copy of it and kind of see our flyer, get more information and when they're held. One thing I did want to mention with the Stronger Together support group is that we have been getting low attendance, so we're kind of thinking about re-strategizing and maybe making a more specific support group, maybe a breast cancer support group or another support group for another type of cancer that might have a high need with little resources, support groups out there in the community. So that's something that we're looking into right now, and we're kind of thinking of what would be the best way to kind of attract more attendance to that group. So any advice or tips or support on that would actually be very beneficial to us. And next slide. And that is all for my presentation. Here's my contact information if you have any other questions. And of course, you can feel free to ask any questions now for the Q&A. Thank you. And sorry for talking so fast. That's always my problem with presentations. I try so hard.
Does anyone have questions for Carlo? You can put them in the chat or come off mute. I'm just gonna there's me saying thank you. I did just want to, if we have a minute, to show the map that Carlo was talking about. So I don't know if you want to talk about it more, Carlo, but I just want to show.
Yeah. So, so as you can see right there through the map, it has all our treatment, like all our kind of treatment options and screening options we have available, like all our resources. So you would click on one, you can click on any one you like. And then it kind of goes to, and it provides you also information of like what screening tests are and what kind of more information for those that don't know exactly what screening tests are available, things like that. And then, for example, that's the Women's Wellness Program. So if you click on that one, it shows you all the Women's Wellness Program locations. So you can click on a site, any one of those, and then it'll kind of provide more information on like what they have available, where their location is, whether they accept types of insurance. And so that can help kind of narrow down what you're looking for. One other thing you can do, Emily, if you don't mind, if you click on that search little button to the left, right there, you can also put like your address. I don't know, you can put, I don't know what address you can put in, but you can put an address in there, and then it'll take you to that area, and then it'll highlight, it'll show what treatment locations are available in that area as well. So you can click on that also. But so yeah, so that way you can see what's available around your area, like in the Denver metro area, things like that. So if you're like in rural parts of Colorado, you can, put your website, your address on there, and you can find it that way as well. If you do decide, if you have a resource or you have an organization that you want on here that you don't see on here, what you can do is if you scroll all the way down, Emily, and you go to the contact us page. So right there, you can actually fill out that form. There's like a little button to click up there, right there. Yeah, you click on that form, it sends you to like a survey, and you can put in all the information of what your organization is and like what services you provide, and then it'll send us that information directly, and then we can go ahead and add it through during our next audit. And it also has my email on there in case you do have questions, or if you do see a resource on there and you have any questions about it, then happy to help and answer anything.
And then the Spanish one is here.
Yeah, that's the Spanish one.
Or Spanish there too.
Yep, you can click there as well. So yeah, that's basically it. Feel free to play around with it, and then if you do have any input or you see anything incorrect, please feel free to reach out, and then I'm happy to make updates for that for sure.
Carlo, there's a question from Paulina in the chat. Do you want me to read it to you, or are you able to?
Hello, are the support groups only on site in your office, or the team open to doing them with community partner? So we're open to doing community partner. Our Stronger Together support group actually started with a church, a local church, because we were working with one of our community advisory council members that had a Baptist church that she wanted to help increase representation for the African American community in support groups. So it actually started there. We were having the group there, but we weren't having enough attendance, so we moved it into a virtual setting to see if that'll help increase attendance. But yes, we actually recommend doing them in the community where it'd be more beneficial for people, especially like in rural parts of Colorado that would benefit others. So we're definitely open to ideas for that.